Hi, everyone. My name's Sanaya Reyes. I'm the Assistant Director of Admission here at Scripps College. Thank you for attending our first Discover event. We'll be focusing on pre-health, pre-med at a liberal arts college. So we have our presenter here with us today, so I'll let them introduce themselves.
Hi, everyone. I'm Susie Fong. I'm the Director of Pre-Health Advising at Keck, and welcome. So let me start by sharing my screen, and then we'll get the presentation started. You want me to start? Yeah, okay. All right, so pre-health advising at a liberal arts college. So which healthcare profession is right for you? So this is kind of where you're going to start. You're going to start thinking, do I want to be a dentist, a doctor, nurse? There's so many different options, but knowing a bit about where you might want to go, or even if you don't, if you think, I'm not sure, but I know I want to go into healthcare, that's okay too. But here's a list of all the different ones that you can do. Can you be pre-health at a liberal arts college? So I'm going to start right off the bat with the most important question, and the answer is yes, you definitely can. So what are the differences between going to a college as a pre-med or pre-health at a liberal arts versus a university? So the liberal arts college, they typically will invest their resources in undergraduate education. So for example, where I'm located at Keck Science, we are helping, or we work in conjunction with Claremont McKenna, Pitzer, and Scripps colleges. They do not have a graduate school attached. The graduate school is at KGI, Keck Graduate Institute, which is separate from us, and Claremont Graduate University, which is also separate. So for example, Scripps will use all their resources for undergraduate only. There's a lower total number of students enrolled, which means smaller class sizes. So I have about 500 pre-health students, and that is out of 3,000 students, so approximately 1,000 per school. If you go to a big university, there's thousands. I believe my counterpart who is at a UC has 10,000 pre-health students and only 2 advisors. So it can be a very big difference. Teaching style is also a bit different in terms of having the smaller classroom discussions. You're able to get to know your professor. You're able to work with your classmates. You're able to know people. You're not one in a lecture hall of 300. It's easier to access faculty and staff. So in the future, you're going to want letters of rec. You're going to want to build connections for future opportunities. And it does make it a little bit easier when you have a class of 15 to 30 students and a professor or a staff member, and to be able to get to know them or ask them if you do need help. There's also more opportunities to get involved in leadership roles. We have a lot of clubs on campus, organizations. If you're interested in something and you want to have a leadership or you want to be able to make a difference, it is a little bit easier to be involved in that. And then a well-rounded education. Of course, liberal arts colleges are also known for being great with the humanities, the sciences, economics, everything you can think of. So you're able to really explore and have everything in your education. So universities, they will invest a lot of their resources in both undergrad and graduate. They do have a higher total number of students enrolled, so there are larger classroom sizes. The teaching style tends to rely on large lecture halls. So for example, I went to a UC, and I do remember being in a large lecture hall, listening to the professor and watching the big screen. But you did break out into smaller groups and met with TAs typically. So it's a different teaching style. You will have more nationally recognized faculty, and then there will be more research opportunities depending on your university. A lot of the bigger schools will have additional funding, so they have options that are already established. So questions to ask yourself when you're choosing, where should I go for college? What's your preferred teaching style? Me, when I was an undergrad, I enjoyed the big lecture halls. I didn't want people to know who I was. I just wanted to sit and go and learn. But a lot of our students at Keck love the small classroom because they want that one-on-one experience. So what's your preferred style for that? What type of extracurricular activities do you want to take advantage of? You know, at a big university, there will be hundreds of clubs. Truthfully, at Keck, we have about 15 pre-health clubs. For some students, that's not enough. For some, it's just the right amount because they can pick which one they want to get involved in and put all their eggs in that one basket. So, you know, it just really depends. Do you prefer a smaller community or a large one? Again, at Keck, everyone knows each other. It is a smaller community. Or do you want one where there's thousands of students? And then the last one is, do you want to have an endless amount of options? One thing about big universities or larger institutions is if you are in a lecture hall with hundreds, you know, 100 to 300 students, how are you going to get that letter of rec from the faculty member? You will have to work a bit harder to get those opportunities to stand out. So pre-health advising. So pre-health advising is a track. For us, it's not a major. For most schools, they don't necessarily have a pre-health, pre-med major, but it's a track, and it's supplemental to your major advisor. So if you are a biology major, you'll have your advisor, and then in this case, you'd have me as your pre-health advisor. I prepare you to be competitive for applying to graduate health programs. I have about 500 pre-health students where I'm at. 80% are pre-med, so pre-med is pretty popular, and then 20% are the rest, pre-vet, dental, nursing, etc. Some undergraduate universities will have nursing majors, so they will have a higher number of pre-health students who are going pre-nursing, or they can have a bachelor's in kinesiology, which is very popular for physical therapy, or they could even have a veterinary track or major. So it really depends on the school, but for us, we are 80% pre-med. I also offer one-on-one advising appointments. So because we are a smaller school, I am able to meet with almost all students if they wish to do so for curriculum planning, how to prepare a timeline for standardized exams, applications. I do a 4-year plan or a rough draft of a 4-year plan so that we could input courses, when they're going to take their exams, when they're going to apply, when they have to get ready. I also do personal statement review, clinical research volunteer programs and opportunities, and then we have our student clubs and organizations as well. Most other schools will also have this, but you may have to go to different places. So you may have to go to the career services for clinical opportunities, the writing center for personal statement review. Most schools will have this type of opportunities, but you'll just have to find it. And then I also have workshops, events. I have pre-health student ambassadors, so I have upperclassmen who are able to answer any questions that anyone has regarding being pre-med, pre-vet, pre-PA. And then I have a website, which is my portal, and then a weekly newsletter that has all the announcements. So what's Keck Science Department? You're probably like, what is she talking about? So we are a science department that's shared by the 3 schools, Claremont, McKenna, Pitzer, and Scripps colleges. We are 3 of the 5 Claremont colleges. There's also Pomona College, which has their own science department, as well as Harvey Mudd College, which has their own. So they have their own pre-health advising centers or areas and their own science department. But the cool thing with us is that we're shared by the 3 colleges. So you're able to kind of interact with students from the 3 schools. For us, we have a 70 to 80% acceptance rate to graduate health programs. The national average can range from 6% to 40% depending on the program. So we are higher than the national average. And then what we offer at Keck Science Department. So again, being at a liberal arts, being at a smaller school, you can form relationships with professors, both in and out of the sciences. You're able to network a little bit easier. And then research with faculty is available. So I know in the previous slides, you know, the bigger institutions do have more research funding, but we also do have funding. Almost every professor at Keck Science does have their own research lab, so they do get funding for that research. We also have the network of KGI and the 5 Cs. So it really depends. You know, some schools are known for having a really big department or cancer research. So if that's what you're interested in, then the bigger institutions might be where you want to go. But if you're looking for just being able to have that personalized experience, not as many students, but still being able to get that research, liberal arts colleges would be a great path for you. So what resources are you going to look for when you look for in a college? Pre-health advisors. How many are there? Do they even have any? Especially if you are looking to do any of the pre-health tracks. It's great to have an advisor. They're able to kind of point you in the right directions. You could research and do a lot of this on your own, but it's always nice to have someone there to kind of guide you. What is the acceptance rate for medical, dental, et cetera, school? So, you know, I mentioned 70 to 80%. So you want to see what other schools have. But also, you must realize that at big universities, there's thousands of students. So even if they have a 40% acceptance rate, you know, you have to look at the context. They could have 1,000 students apply every year, and that's why it's at 40%. So looking at what resources they might have, what are your chances in order to be accepted? Third one, what resources are there for me as a pre-health student? Are there pre-health clubs? How many? Are there any that interest you? What kind of research opportunities are available? How early can you start? And then career centers. Is there interview prep, resume review, internships? Will they help you with resumes? What will they help you with? These are all things you want to look for, and then also make sure you use them when you do go to college. So how to decide which graduate health program you want to go into. Ask yourself, how much science do you want to study? Some students don't want to take OChem or physics, so they find a graduate program where they don't have to do it. How much schooling do you want to pursue? Some programs are 2 years as opposed to 4. And then for pre-med, you have residency after that. So it's an additional 3 to 7 years. So how much school, how much prep do you want to have? How much responsibility do you want to have? Do you want to be a leader? Many times, if you have the personality of wanting to be the leader, a lot of them will go into pre-med. But if you are okay with being under a physician, a lot of students will do physician assistant or even nursing. So it kind of depends on what responsibility you want. What lifestyle do you envision? Do you want a 9 to 5 kind of Monday through Friday job where you can know you're going to have weekends off or know what days and not have to bring home work and not have to work overnight? You know, there's different tracks to that. If you were pre-dental, as a dentist, you can have your own private practice. You can make your own hours. If you work in an emergency room at a hospital as a physician, you may not be able to. You may have to work overnight because the ER is open 24 hours. So what kind of lifestyle do you want? What brings you satisfaction? And then how much are you willing to sacrifice for your career goals? So what do medical and other health profession schools look for? So I thought it'd be nice to give you just a broad spectrum of what are they looking for, so that when you're looking for colleges, you can kind of see if your schools offer this type of opportunities or what opportunities you should be looking for in the next 4 to 5 years. Academic readiness. So GPA standardized testing, you'll want to demonstrate you can manage a rigorous curriculum. So as you do eventually start your first year of college, make sure you go easy on yourself. You need to be able to acclimate to studying, to taking courses, all that type of fun stuff, but you don't want to rush into it because your GPA is very important. And it's hard to make up at the end. So as you go through, make sure you start slow and kind of work your way. Orientation to learning, developing strategy. So again, your first semester, if you find that you're struggling, ask for help. That's okay. It's better to get it at the beginning and do well as you go on and have that upward trend than to kind of struggle in silence for a year or two and then ask for help. Interpersonal skills, ability to work with others. So this is volunteering, community service, leadership. You'll want to have these types of experiences during college and even after. Evidence of understanding your future career. So right now, if you're like, I don't know what I want to do, the best thing to do is shadow a physician if you can. Well, not now because it's COVID, but when you are allowed to go back out and shadow a physician, shadow a dentist, volunteer at a hospital where you'll see nurses, PAs, pharmacists, doctors, because then you get to see what they do and you get to see if that's something you envision yourself to do. That's probably the best thing to do at this point if you're just not sure. And then medical schools and other health professions will also look for personal competencies, characteristics, strengths, leadership, mentoring, experiences, attributes. You know, are you able to work with others? Can you work in a team setting? And then frequently asked questions. So these are some of the questions I get a lot. I don't know anyone that is in the health field. Can I still pursue this? Of course. Even if you have no one in your family that's in the health field, that's okay. You can be the first. You will have to put some effort to look for opportunities, but they're out there. You know, asking, for example, if you wanted to try to shadow a physician and you're like, I don't know a physician. Ask your own personal physician if they know anyone you can shadow. Ask your parents' physician if they know anyone. Ask your relatives, then go to your friends. Use your network first, because it's always better to go that route than to cold call or cold email. Once you do that, if that still doesn't work, then you can go to additional resources like Googling to see what physicians are in your area that you can possibly reach out with. Seeing if there's any alum from your college or your high school that would be willing to help. So you can definitely do it. It will take a little effort, but you can, and there's tons of resources to help you with this. So don't let that be something that stops you ever. Another asked question, liberal arts colleges are not known for their science programs. That's okay. Students from liberal arts colleges are still successful. We still, you know, even at Keck or at Scripps, we still have a 70 to 80% acceptance rate. I'm not sure if we're super known for our science program, but we have a pretty good one, I would say. And you're still able to get, you know, our students into graduate health programs. We have, for the most part, almost all of the prerequisite courses required. So, you know, don't shy away from liberal arts colleges just because you don't think that their science programs will help you. They will. And then that's the end. Does anyone have any questions? I have my email if you have any questions for me. And again, I'm Susie. And then I guess we'll stop there.
Thank you, Susie. That was really helpful. It's informative for me too, even on the admission side, to like have this information. So thank you.
Oh, yay.
Well, I guess I have a question too then, Susie, just to kind of keep it going, about like liberal arts and like pre-health. Do you really think it is common though for like, I think a lot of students to have the misconception that like they can't really pursue pre-med at a liberal arts college? And like, do you think that there are things that like other things that they should be thinking about during their application process as they pursue possibly pre-health or pre-med?
Yeah, I mean, you can do it at a liberal arts or a smaller college, but again, you have to look at the resources. It's not always incredibly common for there to be a pre-health advisor. I am a supplemental staff member, I would say. So for public schools, a lot of times, unfortunately, the advisors are the first to get cut if there's ever budget cuts. So you really just have to see. I mean, it really is your personality. Some students, I have had students who found it hard to be at a smaller school because they want all the opportunities. They want to be able to choose from 100 different clubs. They want to be around thousands of pre-health students. But with liberal arts, I mean, I think it's great if you do want that smaller personalized care. I mean, I'm able to see almost all my pre-health students if you want to make an appointment with me. If you make an appointment, I can for sure see you. But at bigger schools, it is harder. So there is a lot more research involved, which is perfectly fine. But it kind of just depends on how you feel you'll be able to find the resources. Because, for example, there are some UCs who don't even have pre-health advising. So the students literally do everything on their own and they're still successful. And they have clubs and everything and resources. So it's up to you, but, you know, to go back to your question, yes, you can do liberal arts. You can do science and liberal arts, but you just have to make sure that they have pre-health advising of some sort, and that there are science courses and that they have a fairly rigorous program to help you. But most, I will say, do, and most liberal arts colleges do have a fairly high acceptance rate, similar to ours.
I'm curious on your end, like if you've seen like a difference with the students, like in like a women's college experience. Like it's okay if you haven't. I was just curious, my own curiosity.
Yeah, no, I mean, I do have more students who are pre-health from Scripps.
Oh, okay.
Yeah, so Scripps does have my highest number of pre-health students of the 3 colleges. So I see a lot more support, I guess I would say.
Okay.
But
We have one question. Would you say majoring in something non-science would be okay for a pre-med student to pursue in the Claremont colleges?
yes, yeah. So at the Claremont colleges or not, um, most students will do a science because it's helpful. A lot of the prereqs for med will fulfill major requirements for science, but you don't have to. If you are not interested and want to do a non-science, then yes, you can be pre-med. You just have to be able to organize your schedule for the next 4 years and just make sure that you have all the courses for both. One thing I will say though, don't pick a non-science to make you stand out for pre-med unless you are truly interested. Because, you know, even though that does kind of give your application an extra oomph, there's a lot of other factors that go in before that. So you can be non-science as a pre-med, but do it because you want to do it and that you're truly interested. But it can work, and I have seen people do that, and it's perfectly fine.
Question. Do Scripps prepare students throughout the curriculum for the MCAT, or is outside studying necessary?
Mm. So the courses that you have to take, such as biochem, ochem physics, biochemistry, it will prepare you, but you do have to do outside studying. It takes about 3 months is what's recommended to study for the MCAT. So even though we prepare you, you have to do the additional 3 months because the test is very difficult. But there are resources at all the colleges for either funding for preparation or funding for the actual MCAT exam. But in terms of picking different studying, like what programs to use for that, I would usually leave that to the students, and we'll point you to my ambassadors who have already taken the MCAT who can tell you all the tips and tricks.
Thank you.
No problem.
Any other questions? We're happy to answer them.
Yes.
Yes. Thank you all so much for attending. Again, I'm glad that this was helpful, and look out for more Discover Scripps events. Have a great day, everyone. Bye.
Bye. Thank you.